wasn't paying attention because you were on the phone.
Right, but
And I know that you were, well, I guess the both of you were like a little bit hostile. I don't know.
okay. Well, I know I was a little hot because of the problems I've had with her in the past. But
Yeah, but it's
uh,
right.
um, if you recall, the reason was that it was Pulaski Animal Hospital. I was trying to. It was either for Hippie or Misha. I can't remember which one.
Uh
But
huh.
when I hung up from the phone, I did tell you that she told me that she had already regretted speaking with me.
Afterwards, yeah,
But
yeah, because I don't know. She said she kept like like that she was telling you something. I don't know what she was telling you, and that
well,
something like that.
I think the I think the issue that I was having
And
with
she
her,
had mentioned that to me,
yeah,
and
no, I think the issue was the method of payment that I was going to pay for one of the girls' surgeries,
right,
and
right,
she wouldn't accept my debit card, so I had to borrow money from one of my friends, Bruce,
uh
who
huh,
happens to know Cheryl. That's her name.
uh
She went.
huh.
He went to school with her, and
Okay,
she I guess she became a little suspicious because she wasn't sure if Bruce would give me his stimulus check, so she had to confirm it with him,
with him,
and
with him.
yeah, because the stimulus check was on a debit, it was like a prepaid card from the government,
Yeah.
and she wanted to make sure that I guess he was allowing me to use his stimulus payment.
Uh
So
huh.
after she got off the phone with him, that's when I called her, and she, it revolved around previous payments that I used to make with my debit card, and
Uh
never
huh.
had problems paying them or cheating them out of any money. Uh, and it got yeah, I think it did get a little heated. But
Yes, it
as I
did.
as I try to calm things down, I said to her, you know what, thank you, but you won't regret this for accepting
Uh
the
huh.
stimulus payment from Bruce. And her comment was real rude. I already regret it, and she hung up the phone on me. It kind of sounded like
And
she's
that's what I heard when you told me that. What she said.
yeah.
But that's all I heard. That's all I remember.
Oh
I
yeah.
wasn't.
Well, I, I had to turn. Well, I turned up. I know I turned the phone on speaker because I think Grease was in the other room vacuuming or something, so I really couldn't hear her too well on the phone. That's why I thought maybe since I had it on speaker, you might have caught the conversation.
No,
But
I didn't. I'm sorry.
oh,
I
that's
didn't. I
okay.
was.
Well, that's okay because at least I know I spoke with you that who I
Yeah.
was talking with and what she said to me. So I mean that's just as good, you know.
Okay. All
Okay.
right.
Yeah. Maybe tomorrow, Sally. I'll come over for breakfast and.
Okay. All right, Dave.
All
Okay.
right. I'll talk to you later.
Okay.
Bye
Bye
bye.
bye.
Bye bye.
Have a good day. Bye
You
bye.
too.
God
Bye bye.
bless.
You too. Bye bye. Okay. So yeah. Um, I did tell her. Well, she was in the room, and I guess she heard the heated conversation, at least from my end. But um, after I got off the phone with this particular person, I reiterated what the conversation was, and yeah, Cheryl regretted. Well, she was. I guess the word agitated, maybe because um, I was making a stink about why they would now not accept my debit card for the surgery. When in the past, all my uh, visits were paid for with this debit card. I always had money on it. The the payments always went through. I don't know why then she decided she didn't want to take my card. Though I know since then, being at Pulaski Animal Hospital on certain occasions, I noticed that some people that were there in the room who were in front of me were using prepaid debit cards for payments. But, I know who I was dealing with. So I think this was an isolated situation where, I rubbed her the wrong way. That's the only thing I can think of. But this is the type of person that they put in charge of their office staff. I think they can do better. They should do better. So, all right, I got to get ready for my my appointment. I got my call. All right. Okay, it's see, it's already starting to affect me already. Today's Monday. Sorry. June the 19th, 11:18. I'm going to try calling Pulaski Animal Hospital again. Now, I sent the video to their mobile number. I wouldn't be surprised if they delete the files that I just sent them. And if it's deleted, it would only be coming from Cheryl. Cheryl's the office manager. So she is in charge of everything that comes in and out of there, including whatever files are sent to their office. So let's try calling them again. Here we go. Oh, they picked.
Pulaski Animal Hospital, how can I help you?
Hi, this is David Ortiz calling for Misha. I tried. I sent some videos to Dr. Spinder in regards to my concerns about her breathing. I also sent it to your mobile number. I don't know what happened Friday. Initially when I called Friday for Misha, it was just concerning her breathing. But something happened after that, and I'm not going to get into that right now. I'm concerned about her breathing. Is there any way that either if Dr. Spinder doesn't have time to look at the video, if Dr. Collada could look at it, and just to tell me if her breathing is something I should be concerned about bringing her in to look at. I also need to see where she's at currently with her renal failure. Is she still at a stage 2? So I think I might need to make an appointment to have blood drawn to see if her kidneys are stable or if they've gotten worse, and either speak to either Dr. Spinder or Collada about the quality of her life with me continuing with these fluid flushings that I'm administering to her. The only reason I asked for Dr. Spencer because he was the one that was addressing her issues. But if he doesn't have time, maybe he could pass on what Dr. Collada and I have spoken about with him. And I need to see where she's at with her kidneys. She's not eating very well. She didn't eat all day Saturday. So, that's what I need to know.
Okay, I think quite honestly, we should book you an appointment already, if you want to get blood drawn. Just because realistically, if you don't book an appointment now and then you decide you want an appointment, the date's only going to it's only going to be pushed back even further every time you call because obviously.
Well, right. I understand it, but again, Dr. Collada is aware of that. I can make arrangements as long as I can, get someone to give me a ride. So if we can book whatever date, I'll see if I can get someone to give me a ride on that date. If they can't, then I'll call you back and inform you that you can release that date because I can't find anybody, and then you can give me what other available dates you may have, and then I can try to, lock a means of transportation to bring Misha.
Yeah, so already we don't have appointments till July 6th. Collada also leaves for vacation July 4th, so that's why I'm highly suggesting we make an appointment for Misha. So if we decide that the doctor can't see Misha, like, as a drop-off or whatever the case might be, we still have an appointment set.
Okay, would it be Dr. Spinder that may have time to see her, or Dr. Clatta? And the only reason I say Dr. Spinder, because normally it's Dr. Clatta is Misha's primary doctor, but when the issue, the last issue that arose with Misha, it was Dr. Spinder that started treating her and did the blood tests and everything. So that's why I'm asking for Dr. Spinder. But if he doesn't have the time to do it, if he could relay whatever message to Dr. Clatta concerning what him and Dr. Spinder and I have spoken about, just to relay that to him. Okay, so can you check to see if you received those videos? I had to break the file down into 4 parts because it was too large to send via text. So it's in.
Yeah, that should be fine. But did you want me to book you for the student's day I have with Spinder then?
What day would that be?
It'd be Saturday, July 15th.
And today is
June 19th.
Okay, well, what do you have available for? No, I understand what you're saying. Sorry, what do you have for Dr. Clatta?
I have nothing for Dr. Clatta right now. Dr. Clatta, especially because he's going on vacation, he's going to be out of the office, so we're pretty much, Clatta doesn't have any available time.
Okay, what about a possible drop-off pickup?
I could discuss that with him, while I show, like, the images that you sent over.
Well, yeah, okay. He also has a video sent. I sent it to his personal phone.
Okay.
So if you can ask him about that, and I need to have blood drawn because the way she is right now, I don't know if her kidneys have gotten worse, and if they've gotten worse, I mean, would it be feasible to wait that long?
Yeah, let me just. Do you want me to put you on hold then?
If you sure, and your name is, I'm sorry. Are you
Nydia?
Nydia? Are you the one I spoke with Friday concerning Misha?
No, I don't think so. I think I was there in the office. I only got to see your behavior in the office while you were talking to my coworker.
Right. Okay. Yeah. Well, I apologize for that, but when I'm told to bring her in because the staff is there waiting for her, and I find that out. Yeah, I think anybody would react the same way. Wouldn't you agree?
It's not my place to really disagree or agree. I'm just here to do my job. So.
Right. Okay.
So I'm not going to tell you if I agree with you or not. But let me put you on a brief hold and then see what I can do for you. Is that okay?
Sure. Thank you.
Okay. Thank you.
We provide care for your pet in an ongoing, safe manner. During this time, our doctors and our phone lines have been exceptionally busy. Please understand that wait times may be significantly longer than normal, and you may have to call multiple times before reaching a team member. You and your pet are extremely important to us, and we'll be with you as soon as possible. Do you know how important vaccinations are for your pet and their health? Vaccinations can protect your pet from diseases such as rabies, distemper, parvovirus, feline leukemia, bordetella, leptospirosis, or Lyme disease, and more. We'll tailor a specific vaccination schedule to your pet's lifestyle and age. Ask a team member if it's time for your pet's vaccinations, and schedule an appointment when we return to the line. We would like to take a moment to acknowledge our veterinary technicians and all they contribute to our practice. Our technicians hold a wide range of roles to provide your pet with the highest quality care and ensure our practice continues to operate smoothly. We want to thank them and all of our staff for their hard work and dedication to our practice, and the well-being of our patients. When was the last time you brought your pet in for a wellness exam? We know you have a busy schedule, but we want to remind you of the importance of scheduling your pet's annual wellness exam. These exams help us stay up to date with your pet's health and allow us to provide more timely treatment if necessary. We can also monitor any ongoing conditions, giving you peace of mind. If you believe your pet may be due for their annual wellness exam, let us know when we come back. Looking for new ways to safely socialize your beloved canine companion? Try meeting up with a fellow pet parent for some one-on-one playtime. You can also bring your dog to a pet-friendly retail store for increased exposure and interaction with other pets. This makes it easier to watch your pet's body language and comfort level around other dogs. Once your dog is fully vaccinated and socialized, dog parks can be another way to let your dog run, jump, sniff, and play. For more tips on safely socializing your dog, ask a member of our team when we return to the lines. Allergy season doesn't just affect us, it can affect your pet too. Sneezing, watery eyes, runny nose, and itchy skin could all be signs your pet has an allergy. If you feel your pet is suffering from seasonal allergy, let one of our staff members know when we return to the line. We can make an appointment for an allergy consultation to help your pet feel their best. Please stay on the line. We'll be right with you. Thank you for calling Pulaski Animal Hospital. We're located at 5424 South Pulaski Road in Chicago, 4 blocks south of Archer Avenue on Pulaski, 1.5 miles south of Interstate 55. Visit www.pulaskianimalhospital.com for directions. Our hours are Monday through Friday, 9 a.m. to 5 p.m., and Saturday, 9 a.m. to 3 p.m. We are closed on Sunday and all major holidays. Appointments are required for all services, and walk-ins are accommodated only if there are cancellations. For established patients, we offer drop-off appointments where your pet will be examined when time permits, and we'll call you to arrange a discharge time. Thank you for holding. We'll return in just a moment. Pulaski Animal Hospital is proud to be named one of the area's top clinics according to Chicago Magazine. In addition, we're also a member of the American Animal Hospital Association, AHA. AHA sets standards for veterinary hospitals to meet in areas such as patient care, client care, pain management, and many others. We regularly undergo inspections to ensure that we provide the highest quality care possible and make changes according to AHA recommendations to remain progressive as we serve our clients and patients. Ask one of our trained professionals more about AHA standards when we come back. Pulaski Animal Hospital is a full-service hospital serving families from the Chicago area. Our trilingual staff is here to serve our patients and clients with quality care, treating your pets as our own. We can provide services in English, Polish, and Spanish. We offer early drop-off services for diagnostic and surgical procedures. Ask one of our caring staff members to answer any of your concerns when we return to the line. The weather is getting warmer, and our pets are enjoying the outdoors longer as the urge to explore new territories grab their attention. As they wander further and further away from home, they may be unable to find their way back. Microchipping is a great way to easily identify pets and get them home safe. The doctors at Pulaski Animal Hospital are qualified to perform the simple task of injecting the tiny chips under your pet's skin. Please stay on the line and inquire about the benefits of microchipping when we return. At Pulaski Animal Hospital, we provide a full range of veterinary care for your pet, from the initial appointment through diagnostics and treatment. Our veterinary hospital has state-of-the-art diagnostic equipment, such as ultrasound and radiography technology, to identify many diseases, cancers, and other problems. If you're waiting for test results, please ask one of our professional staff when we return in a moment.
Oh, really? If you're waiting for test results, ask any of our professional staff. I did that in the past, and I still couldn't get Misha's test results until about a week later.
At Pulaski Animal
Something's
Hospital,
fishy.
when your pet is sick, we offer a wide range of care for your pet. Our laboratory facilities, both in-house and out, allow blood, urinalysis, and parasite testing to be done quickly and provide accurate results to tests needed to treat your best friend. We offer consultation with specialists in the area of cardiology, orthopedics, and internal medicine. Ask one of our trained associates for more information about our lab services when we return shortly.
Hello?
Hello,
Hi, is this David Ortiz?
speaking. Is this Maria?
Okay. No, this is Nydia.
Oh, hi,
Thank you for
Nydia.
holding.
You're
So
welcome.
I actually spoke to Dr. Spinder, and he had told me, he had informed me that he already sent you a message on Friday, I believe he said, regarding Misha, and I believe he also mentioned that he had told you we don't necessarily have time to see Misha, and if you would like your records, we can send them over to you.
Okay, that was all right. The message specifically said if I was unhappy with their service. It's not that I'm unhappy with the service. It's that I'm unhappy with your office manager. The doctors I have no problems with. I explained to him in response that I sent him with that message that the treatment that she gets from Dr. Collada and Dr. Spender are excellent. The problem is with your office manager. Now, so because I don't know if I'm assuming that he's turning away Misha's treatments because
No, not necessarily. Just also another thing to keep in mind is that we're not an emergency center, so we go by appointments only. So if the soonest appointment we have isn't fitting for Misha and what Misha needs, then you are more than happy to go somewhere else to an actual emergency center where they can see Misha sooner. But if you want to stay with us, the soonest appointment I have is July 6th, sir.
July 6th? Okay.
Yeah, and I would not be able to do a drop-off for you
You would not be able to do a drop-off.
as of right now, yes.
Okay, so July 6th. What time July 6th?
Earliest I have would be a 12:30, and then the latest 3:30.
Okay, so the 12/6, would that be Dr. Spinzer seeing Misha?
If you want Dr. Spinder, the soonest I have would be July 15th.
Okay. And July 6th would be Dr. Collada, correct?
No, July 6th would be, well, depending on the time, I was just going to find you a doctor based on the time slot, because Dr. Collada, like I had mentioned before,
Okay,
is going
right.
to go on vacation.
Okay, so who would that be? Dr. Christie?
Yeah, I have a 12:30 for Dr. Christie and a 3 o'clock for Christie.
Okay. Is there any other sooner date to see with Dr. Christie other than July 6th?
I can maybe take a look. There might be some cancellations, but give me 1 second
Sure,
to take a look.
sure.
Okay, yeah, so unfortunately the soonest is July 6th with Christy.
Okay, and that's it. What time? What you have 12? Did you say?
I have a 12:30, and then latest 3 o'clock with Dr. Christy.
All right. Let me have the 12:30 slot with Dr. Christie then, July 6th.
Okay.
Okay.
And then, of course, like, if anything changes, we can give you a call, like, with any cancellations.
For an earlier appointment.
Time date? Yeah.
Okay, that would be great. I would appreciate that.
Yeah, of course. And then, but I just don't want to make any guarantees, you know?
What do you mean you don't want to make any guarantees in regards to what?
Like, in regards to, like, if somebody cancels, because you know you can't really determine.
Oh, right. I mean, if nobody cancels before July 6th, well, then at least I'm locked in for July 6th, right?
Yep. Mm-hmm.
Oh, okay, that's fine then.
And then it's for an exam, blood work, and what else did you mention, sir?
Well, again, if Dr. Spinder can call me at the end of his day, and that's, specifically why I called last Friday, was, and again, I'm just going to reiterate real quick. When I called Friday, it was just basically for her breathing. What happened after I spoke with Marina, the girl's name was like Marina or something. She had, I don't know what happened to me when I found her laying on the floor. That was a completely different issue from what I originally called on. So, yeah, the breathing, if Dr. Spencer can just, call me and advise me if he listens to the video, just to know if this is something I should be concerned about, or if this is, something that's maybe common.
You know what, I have put you on hold.
Well, you know what, how about if we do this?
Yeah.
I don't want to take up any more of your time. I don't want you to interrupt Dr. Spinner because I know he's busy. Just ask him if he can call me after he looks at the tape and listens to the breathing. I just want to know, is this something I need to be concerned about, or if it's something that's common? I don't know. If it may, or even if possibly the breathing may have something related to the treatments I'm giving her. That's it. But at the end of his day, before he leaves, and it will take no more than maybe 2 minutes of his time.
Okay.
All right. Thank you. And your name
Yeah,
again is Nydia?
Yeah.
Thank you, Nydia. I appreciate it.
Yep. Yep, of course. Have a good one.
You too. Okay. So, I got through. That's good. Okay. Concerning my behavior, yeah, and then again, I'll reiterate. I get there, I'm fine, because I'm told to come in because somebody, I think it was Marina or something like that, not Nydia, it wasn't her. But I followed their instructions. I called, I voiced my concerns. I know I was emotional, not like you screaming and raving like a complete lunatic. I was in tears when I called and explaining how I found Misha. I walk into the clinic after they told me, yeah, we're waiting for you. Everyone's aware. When I get there, they're like, you don't have no one to see her. We don't know what you're talking about. Now, how would you respond when you've got, and after what you've seen, well, what I've seen, I should say, any reasonable thinking person would do probably the exact thing that I did. And what I did was like, whoa. When she told me there was nobody, I said, whoa. I said, wait a minute. I said, no. I said, I was told to come in. Now, I didn't use any vulgar language. And I never do. I get excited, but I also have to defend them. I'm following their instructions. I called. If they didn't have the means or capacity to see me with that urgency, they could have said, sorry, we can't. The girl said, okay, that's how you found your pet. Let me go talk to the doctors, explain to them what has just happened. That's what and she did. I waited. She came back to the phone, and that's when she told me she didn't tell me. She first asked me, how soon can you get here with her? And as I reiterated in the last part of the earlier video, I brought her and expecting, because I'm told that they're waiting for her, to be told, no, there's nobody here, and there's nobody to see her. Not as much as it's a waste of my time, but the ride that I asked for and the help that I got from my neighbor was a waste of his time, a waste of his gas, and possibly if this is what he's done and it was for no apparent reason to be there, he may not want to offer me a ride to help take her to any appointments that I need to take her to. So yeah, I got a little hot, but I didn't swear. And I'll tell you exactly what I said when the girl Maria told me that there's no one to see her. I said, well, you know what? I told the girl I'm following her instructions because I'm basically assuming that this is what whoever she spoke to, who is probably a professional, she would have to tell a professional doctor what the reason why I'm coming in with Misha for is being told to her. And if they're telling me nobody knows, well then either this girl is lying to me for whatever reason, or there was some change because they don't want to deal with Misha or me. But that, I'm pretty positive, is coming from Cheryl, because she is the office manager. So, these girls have to go to somebody. They probably, when they speak with me, they go and relay whatever messages or whatever they need maybe guidance in doing with Cheryl, because she's in charge of supervising their staff. So all these, other than medical determinations and evaluations, that comes from the doctors. Anything other than that, all through Cheryl. And just because I call and ask questions that she gets annoyed by it and she feels that she doesn't want to deal with it, that's not her. That's too bad. That's what your job is. That's what your title is. You deal with customers' complaints. Not as much as complaints that I call Cheryl on. If I have to speak with Cheryl, it's solely to either get advice, to see if she can relay messages to the doctors, because either the girls may forget, I don't know, but I need to make sure that these messages get to who they need to get to. And Cheryl is the office manager. She can relay the message to the doctor, and then at the end of at Cheryl's convenience, before the end of the day, just either call me back or have one of her girls call me back and let me know what I should do. If Cheryl doesn't want to talk with me, then fine. Whatever information you get from the doctor, give it to a staff member and have her call me so she doesn't have to deal with me. It's when she promises to call and it's obvious that she has no intentions in calling, that, all right, don't make promises you can't keep, that you don't want to keep, and just tell me, yeah, you call me just to get me off the phone so you don't have to deal with me. No, that's not how it works. Again, you don't have to like me because I ask questions concerning their health. Well, now it's just one. Thanks, Cheryl, because you failed to provide the information that I sent at the earlier part of the week to a doctor. Poor hippie had to suffer. That was your decision. Because I found out that you did see the videos, but you didn't act on it. You just brushed it off to the side. Didn't bother to tell Dr. Collada. Didn't bother to inform me of what you think. And that was it. Because you told me that you've been in that business for a long time. You know what you're looking out for. And that's why I leaned towards you, because I was looking for some advice from you. Simply, with the pictures that I sent, the videos that I sent, do you think I should make an appointment to bring her in? And if it was time to say goodbye to Hippie, then I would do it immediately, there and then. Don't just look at the videos and do nothing. If you don't want to give me the advice, then, just give it to the doctor. Pass it on to the doctor. But you couldn't do that. You preferred just to brush it under the carpet. Well, your actions, was the end result. Hippie had to suffer for 4 days after I spoke with you. Or not you, but I spoke with the girl. And each time, you're always busy. It wasn't until the last message that the girl told you, or you told the girl, that you would call me in 3 minutes. You never did. But this is how you are. People that annoy you, you ignore. Well, you can ignore me, but she's the one you're supposed to be working for, caring for pets. And that's what you claim on these little messages that I have to listen to when I'm put on hold. That Pulaski Animal Hospital is a caring facility. Now, let people decide that, right? Okay, I'm starting this video again. Apparently, Pulaski Animal Hospital just tried calling me. I didn't get to the phone fast enough, so I'm going to call them back to see what they're calling for.
Pulaski Animal Hospital, please hold.
Sure. I was just about to get Misha's treatments ready to give her.
Pets have teeth too. Imagine how you would feel if you didn't brush your teeth. Your pets feel the same way. Oral neglect can lead to other serious medical conditions if not corrected. At Pulaski Animal Hospital, we recommend regular checkups for good oral hygiene, professional cleaning and brushing to keep your pet's pearly whites bright and shiny. Ask one of our trained staff members to schedule your pet's dental appointment when we return to the line. Pulaski Animal Hospital wants to remind you that spring is the perfect time for you and your pet to start that new exercise regimen you've been thinking about. Fun and variety are key elements to any successful exercise program, and a great way to bond with your pet. Hello?
Hello, hi, this is David Ortiz. Somebody called me from the hospital, but I was in the middle of setting up Misha's scapulous treatment.
Yeah, okay, so this is Nydia. I'm calling, yeah, of course, with the Animal Hospital. I'm calling back only just because I spoke to Dr. Spender again, just to let him know that we had booked you for an appointment, and then also to, because you know how you had asked me to
Right.
ask Dr. Spender if Misha's breathing was normal. However, I was just like informed, like when he had messaged, like if you were unhappy with like your service or here, that was and him like offering to send over the records was him kind of like refusing, like we're gonna send you your records and we're gonna depart, as in we're not gonna service Misha anymore.
And why is that?
Just because I guess every time you kind of come in, you kind of just mistreat the staff.
Oh, I mistreat the staff. Okay, so that day that you saw me, when I came in,
And then also just alone, like Dr. Christie isn't going to, they're just not going to see Misha.
okay,
So
so
we can happily send over your records. And you know what? Me making the appointment was my bad and my misunderstanding of what Dr. Spender had meant when he had messaged you about the service here.
okay, so I just want to clarify something. Me mistreating the customer or the staff by me voicing that, when I'm told by the staff I'm going to receive a call and I never do, of course, I'm going to be upset. And
I mean, yeah.
well, no, let me,
yeah,
if I may, let me just, I just want to just so that you
Yeah, go
understand
ahead.
and you can relay
Go
this to
ahead.
the doctor.
Yeah.
When initially, okay, so this is a problem with your office manager. It has nothing to do with the quality of the treatment that Misha's gotten. It's normal when somebody is promised a phone call and it never comes. People are going to get upset, of course. But never at any time have I ever addressed any of the staff there in a vulgar manner by swearing or anything. If I'm told to bring my pet in, which I was told that day, Friday, by Marina or I can't, whatever the name was, I'll remember it if it was told to me. She told me to bring Misha in. I did that. I came in, Maria, when she asked me, can I help you? And you were sitting right there. I did say, I'm here with Misha. I was told that your staff is waiting. It's when she comes back and tells me nobody's here to see her. Well, at that point, yeah, I'm going to get a little upset. And you heard exactly what I said. I didn't swear at anybody.
I'm sorry, like, I'm not here to disagree or agree with you.
Right, no, but I'm saying, so this is not a question of, me, being unhappy. You're doing this because you're trying, it's either you're trying to, not you per se, but Pulaski Animal Hospital wants to hurt me, or you want to hurt Misha, because
Sir, I don't. No, we were completely fine servicing you guys up until we kind of get like the staff feels mistreated. You have on the occasion on Friday when you came, you did say Cheryl was worthless. There's like.
Oh yeah, well at that point, yeah, because I did say that.
No denying,
Yeah, and of course, and I still feel that way. When you have a staff, all right, an office manager, who's given information concerning 2 terminally ill patients, and Pulaski Animal Hospital is aware of that. Both Misha and Hippie were terminally ill. That as a part of the veterinary code of ethics, their duty is to treat them. But when she withholds vital, information concerning what their health is, and all I was asking the day that I submitted those videos concerning Misha and Hippie, especially Hippie, if Cheryl couldn't answer that, she should have passed it on to Dr. Collada to inform me if, well, you know what, she, Hippie made a turn for the worse, bring her in if you want to, have her put down. But no, Cheryl didn't do that. All she did was put it off, put it off, put it off. And then when she tells me she was going to call me in 3 minutes and never calls, and then everything goes south and Hippie ends up having to be put down 4 days afterwards, yeah, I'm going to be upset. Because if Cheryl couldn't address me then, she should have just told one of the girls to say, I'm going to pass this on to Dr. Collada. Dr. Collada will, will call you, or maybe you should bring her in because it doesn't look like she's going to last very long. I could have made that decision right there on the phone, while I was speaking to him, whether or not to bring him in. But okay, so this is, again, treatment. Okay, treatment. Possibly, and you may want to pass this on to Dr. Spencer, that if you're concerned about how your staff is being treated, perhaps he needs to speak with his staff on if they make a promise to a patient's owner that they're going to call, then they should do so. If not, then this is what type of reaction he can expect from the patient's owners. Because this is only a natural human response. When you're promised something and you don't get it, of course you're going to get upset. Fortunately for you, not you, but the staff there, I've never reiterated anything in a negative, vulgar manner by swearing or anything. I've always been as polite as I possibly can. But again, it's obvious now that Dr. Spender doesn't want to correct the problem that he has with his office manager. He'd rather just have her be the way she is, regardless. Okay, so let me ask you this. So until I find somebody that is, that I can trust to deal with her, can I still get her prescriptions that she's taking now?
Let me double check with you, but real quick so I can send over the medical records.
No, I'm going to be coming in for it. I'm going to be coming in for it.
Oh, okay. You want the like a hard copy?
I want everything.
Okay, that should be fine. But let me put you on hold and figure out if you can still receive a last prescription of the medicine.
Well, it just also she gets these fluids, so there's going to be prescriptions called in from Chewy that need to be filled.
Yeah, let me just double check how that would work. Okay.
Okay.
Okay, let me put you on hold.
Schedule, but we want to remind you of the importance of scheduling your pet's annual wellness exam. These exams help us stay up to date with your pet's health and allow us to provide more timely treatment necessary. We can also monitor any ongoing conditions, giving you peace of mind. If you believe your pet may be due for their annual wellness exam, let us know when we come back. Looking for new ways to safely socialize your beloved canine companion? Try meeting up with a fellow pet parent for some one-on-one playtime. You can also bring your dog to a pet-friendly retail store for increased exposure and interaction with other pets. This makes it easier to watch your pet's body language and comfort level around other dogs. Once your dog is fully vaccinated and socialized, dog parks can be another way to let your dog run, jump, sniff, and play. For more tips on safely socializing your dog, ask a member of our team when we return to the lines. Allergy season doesn't just affect us, it can affect your pet too. Sneezing, watery eyes, runny nose, and itchy skin could all be signs your pet has an allergy. If you feel your pet is suffering from seasonal allergies, let one of our staff members know when we return to the line. We can make an appointment for an allergy consultation to help your pet feel their best. Please stay on the line. We'll be right with you.
Didn't I tell you? Didn't I tell you?
Thank you for calling Pulaski Animal Hospital. We're located at 5424 South Pulaski Road in Chicago. 4 blocks south of Archer Avenue on Pulaski, 1.5 miles south of Interstate 55. Visit www.PulaskiAnimalHospital.com for directions. Our hours are Monday through Friday, 9 a.m. to 5 p.m., and Saturday, 9 a.m. to 3 p.m. We are closed on Sunday and all major holidays. Appointments are required for all services, and walk-ins are accommodated only if there are cancellations. For established patients, we offer drop-off appointments where your pet will be examined when time permits, and we'll call you to arrange a discharge time. Thank you for holding. We'll return in just a moment. Pulaski Animal Hospital is proud to be named one of the area's top clinics according to Chicago Magazine. In addition, we're also a member of the American Animal Hospital Association, AHA. AHA sets standards for veterinary hospitals to meet in areas such as patient care, client care, pain management, and many others. We regularly undergo inspections to ensure that we provide the highest quality care possible and make changes according to AHA. Hello?
Yes.
Hi. Okay, so I figured we are able to offer you like one last dosage or like one last prescription of everything if you'd like.
Why not?
We could do. Huh?
And why not?
I said we can.
Oh, you can. Okay.
Yeah.
Okay. I'm sorry.
Yeah, that shouldn't be a problem.
Alrighty. Okay. All right. How soon would you be able to have those records available?
If honestly we can get them printed out when you arrive on your arrival, or I can start working on it and then we could have it. If you wanted, you could stop by later today and pick them up.
It'll be a question of whether I can get a ride to get there. But I would prefer if you can just have them ready. I'll call when I'm able to get there. I'll just tell them I'm coming in.
Okay, perfect. Then I will get these printed then for you.
Okay. Thank you.
Yeah, of course. Bye-bye.
Bye-bye. See? They don't like when people come in upset. Okay? Well, they wouldn't have that problem if they knew how to work and act professionally. You're an animal hospital. You're supposed to care for these pets. They're your patients. If you're unable to provide medical information or provide the test results in a timely manner, then tell the patient's owner the case. Tell them that, I can't give you the test results now. We'll give it to you later. But if you give it to them later, you make sure that you give them to them later. Just don't say, we'll call you back, and then never call back. Because the more frequently that you use that, excuse with a patient's owner, and you don't follow through with what you promise, you can expect the type of reaction that I gave, which was I was upset, but I never swore. I never screamed like a banshee or slammed things around or pounded my fist. I acted as any reasonable person would respond if treated the way I've been treated, or according to these Google reviews, how other pet parents have been treated by the staff. Primarily, a lot of these complaints are geared towards the office manager, or directed towards the office manager, I should say. Well, okay. So, if Dr. Spender, if you know what type of reviews you're getting, because I know you are, because you're responding to a lot of them, except for the ones that, their pets have passed away because of something your staff has done, or they may have passed away or gotten sicker because of a lack of a quick response or lack of response completely, then there's an issue that maybe you should address. Obviously you haven't, because the problem still exists and is still going on with Cheryl. And some of these negative reviews go back at least 4 years, from what I could gather. But I just started going through the Google reviews, and I think I'm just going to go as far back as Google reviews will take me to see how many negative reviews there are concerning no callbacks, that's the majority of them. The same reason that I'm giving, no callbacks when they're told that they're going to get one, or they're being treated rudely by the staff or the office manager. But you have the audacity to say you don't like the way that people treat your staff members. Well, maybe you need to talk to your staff members and learn how to deal with clients in a professional manner and in a timely manner. But this isn't over, because I'm going to get a lawyer now, and I'm coming after you, Cheryl, with litigation as well for negligence. You're a cancer that should be removed from that establishment. Okay, today's Wednesday, June the 21st. Doing a video journal for my girl Misha. I'm gonna find out from Pulaski Animal Hospital what the cost is for the. I have to administer with her subcutaneous treatments a vitamin B12 supplement while I'm administering the fluids. So I'm just documenting this. So for my records, I was told that because of an incident that occurred at their office Friday, that they will no longer treat Misha. So they said that they will continue providing me with her medications, but they won't treat her with her renal failure. Everything else that she's suffering from right now, but they're still willing to sell me her medication. So I'm gonna just keep this for my record of what they charge for the vitamin B12 complex. It comes in a syringe. It's like a pinkish translucent fluid. This way I can keep it in my record and compare prices if in the future I need to shop elsewhere. So let me call them right now and see if they even answer the phone. They don't answer.
Pulaski Animal Hospital. I'm gonna take care of her. I'm taking care of that one.
They just hung up on me. They just hung up on me.
Animal Hospital, please hold.
Mm-hmm.
Can't decide on whether to spay or neuter your pet? Spaying or neutering can prevent unwanted and unloved litters of pets and can also improve your pet's overall temperament, along with
This is what they do.
mammary tumors in females and behavioral problems in males. At Pulaski Animal Hospital, we recommend spaying or neutering your pet before the age of 6 months. For more information on the pros and cons of spaying or neutering, or to make an appointment for your pet, please stay on the line. One of our trained professionals will be with you in a moment. Nobody likes seeing a stray cat or dog wandering around the street or brought to a shelter. At Pulaski Animal Hospital, we offer spaying and neutering services to prevent unloved litters of pets. Spaying and neutering is recommended before 6 months. It can also improve your pet's health and life expectancy and eliminates the possibility of uterine,
Let's see how long they
ovarian,
have me on
and
hold.
prostate cancer. We will be happy to answer any questions and schedule your pet's spaying and neutering appointment when we return in a moment. Our animal hospital is proud to be accredited by the American Animal Hospital Association, or AHA, regular
I'm going to
basis.
have to charge
And our
my phone
accreditation
because
is
this might
very
be a long wait.
on our exceptionally high standards. We pursue our AHA accreditation as a means of showing you just how much we care about your pet. Want to know more about what it means to be AHA accredited? Ask us today. Pets have teeth too. Imagine how you would feel if you didn't brush your teeth. Your pets feel the same way. Oral neglect can lead to other serious medical conditions if not corrected. At Pulaski Animal Hospital, we recommend regular checkups for good
So when they hung
oral
up on me the first time, it was just before 11 a.m. It's currently 1 minute after 11.
To schedule your pet's dental appointment when we return to the line.
Okay, we're going on almost 5 minutes of waiting.
Pulaski Animal Hospital wants to remind you that spring is the perfect time for you and your pet to start that new exercise regimen you've been thinking about. Fun and variety are key elements to any successful exercise program and a great way to bond with your pet. For more springtime fun tips, please stay on the line and we'll return in a moment. Is your pet moving a little slower these days? Doesn't have the vim and vigor of their youth? Our pets age at a much faster rate than we do. At Pulaski Animal Hospital, we want to make sure that your beloved companion lives a long and healthy life, which is why we recommend a semi-annual wellness exam and glaucoma screenings for our senior patients, so we can catch any age-related problems in the beginning stages.
I'm right here, Misha. I'm
Early
right here.
detection is essential in maintaining the health of your pet during their golden years. Your call is important to us, so please stay on the line, and we'll be right back. Do you have a tubby tabby or a dog that waddles instead of wiggles? Could be your pet needs to shed a few pounds. Heart disease, diabetes, and joint problems are some symptoms an overweight pet is prone to and can be avoided through proper diet and nutrition. At Pulaski Animal Hospital, we can recommend effective weight loss diets to shed those unwanted pounds, along with guidance on nutritional and dietary requirements for all your pets.
Here I'm just calling to find out what the charge was that they were charging me for these syringes of vitamin B12 complex. This is my theory, what they're doing. They're going to just leave me on hold until I decide to hang up. I don't think they're going to, their intentions are ever coming back to the phone.
In addition, we're also a member of the American Animal Hospital
We're already up to
Association.
7 minutes,
AHA
10
sets standards
seconds
for
on
veterinary
hold.
hospitals to meet in areas such as patient care, client care, pain management, and many others. We regularly undergo inspections to ensure that we provide the highest quality care possible and make changes according to us. Thank you for holding. Have you been taken care of or not yet?
No, not yet. My name's David Ortiz. I need to get a price on what you were charging me for Misha's vitamin B12 supplements that come in the syringe for her subcutaneous treatments. How much were you charging me per syringe on that? And if you can tell me, is there does it list the dosage that comes in each syringe and who the manufacturer is?
It doesn't because we pre-mix it, so we have to mix it. We usually mix it by hand when we make them.
Oh, it's pre-mixed.
Yeah, so we have to mix them for you. They don't come pre-made.
I see.
Let me see how much it was costing you. Hold on 1 second.
Is it difficult? I'm sorry. Is it difficult to do that?
To mix?
Yeah.
It just depends if you have the medications, because they are like, it is like their actual like medicated vials. So,
Okay.
yeah. So I mean, you have to premix them both, and they're kind of done in the same syringe and stuff like that. So.
Okay. And these have to be refrigerated, right?
Correct. And
Okay.
they have to stay in the dark as well. But it looks like for the syringes, where's that? Sorry, it's because there's like a lot going on here. I have to kind of go through each one.
Sure. And I'm sorry. What is your name? In case we get disconnected.
My name's Melina.
Melina, did I speak with you last week in regards to Misha?
You did.
Okay. Okay. Did I speak with you in the early morning, or was that when Misha had that? I think she had a seizure.
You're talking about when she collapsed?
Right. Okay. So you were afterwards. Okay.
Yeah.
Okay. Thank you. I appreciate it. Oh, Melina.
So
Yes. Go ahead.
last time, okay, so you guys picked up on the 1st of June, right? You picked some syringes up that day?
I had someone pick him up for me. He picked them up
Okay.
in the
so
evening.
You did order them.
Yes, I did.
Okay, so they charge you $4.17 per syringe.
Okay. Okay. Now, so that would be just vitamin B or B12. What is that?
It's vitamin B12 and B comp.
Oh, and B
So
comp.
it has vitamin B12 and then it has it has a different medication as well aside.
I didn't know that. Okay. One more question, and then I'll hang up. When you told me to come in, that they were waiting, everyone was waiting. Who did you tell?
The doctor's in the back.
And that was Dr. Spender or Dr. Collada? Because at that point, I didn't really care who saw Misha.
They were the doctors in the back, so Dr. Collada was also one of them. But they're the three doctors that we had in back. Dr. Spender had already left for the day.
Okay. Because when I got there, they said that you had already left, and that nobody was going to see her. Why would I have been told that? Was
no,
that?
don't understand because everybody was aware.
All right, so that would have been Cheryl, possibly, that said not to bother them. Because she's the office manager.
I don't think so, because she also knew and was aware and was okay with it.
She was.
Yes, everybody was aware.
So we don't know who changed their mind then.
No, I do not.
Okay. Alrighty. Thank you so much. I appreciate it.
No problem.
Right.
Take care.
Bye-bye.
Bye.